But we have made progress from steering teens away from cigarettes and hard tobacco. While there are less teens who are smoking cigarettes, they've now turned to a new way to get their nicotine by vaping. Schools are doing as much educating as they can, but the devices are changing so quickly, it's hard to know what to look for. Take these highlighters, for example. That's what they look like, but they're actually vapes. School officials say these companies are targeting youth by making products a perfect option for those who want to vape discreetly while in public.
I mean, when you think about how companies are making these so easy to hide, you really got to be paying attention and up on what the most current thing is to look for.
And the Medford School District does that by also educating teachers on what these vapes might look like. But anytime a student is caught with nicotine paraphernalia, their penalty is watching educational videos on why vaping is so bad for their health. He also said something that is really lacking is not only more prevention education to get ahead of addiction, but schools are also lacking addiction treatment and even resources. And continuing our coverage tonight, the controversial drug bill Measure 110 may be overhauled by a soon-to-be bill introduced by state legislators. We take a deeper dive into what both of the sides are saying. Here's News Watch 12's Rocky Walker with more.
I think it just leads to a lot of things that are going to be very convoluted and create a lot of challenges for organizations to try to manage.
Jackson County Sheriff Sickler's opinion mirrors that of the Oregon Sheriff's Association, Police Chiefs Association, and Oregon District Attorney Association. They say the bill simply does not do enough, while the other side of the aisle says the bill has an approach that's too harsh and will criminalize those who need medical intervention.
Really what we're trying to do is shoehorn a solution that's a policing solution to a healthcare problem.
Imagine Black is partnered with the ACLU and Oregonians for Safety and Recovery to fight against the bill. She says policing a health issue makes a revolving door in the jail and prison system. She says there needs to be an open door to resources before policing someone in addiction. The sheriff's office, though, says this policing isn't enough. They say without an A-level misdemeanor or felony, people will not be willing to get better.
I think if we go down to a C misdemeanor, I don't think we're going to see any willingness for people who are obviously not making good decisions.
Sickler says a Class C misdemeanor is so low in priority that it would be hard for the justice system to draw attention to that level of crime in an already overburdened system. Harris says this will simply overburden prosecutors and jail systems that are already bursting at the seams.
The system that we have relied on again, right? It's been over-policing. It's been trusting this war on drugs process over the last 50 and 60 years. Look at where we're at. This didn't happen out of nothing and nowhere. This took time to get this bad.